So welcome. Thank you. Thanks to everyone here virtually as well. Nice to see some familiar faces, some people I've worked with many years ago. Um, we know as communicators that what we have to do is really develop compelling stories, and that's to reach people in, bad times, good times, but it's to create some kind of a feeling. And we wanted to actually start and just take a moment. I'm going to do something that I hate when people do this in conferences. But if you can, close your eyes and just think back to a campaign, a project that you were just really, really proud of. Think of the team that helped you. Think of, all the elements of that. And think about what it was you were grateful for, what gave you strength in that moment, how you felt, and really hold that in your memory and just hold it throughout the entire talk that we're going to give. And then we will come back to that at the end. Sorry, that's me. I have to click it. All right. So now I'm going to introduce myself. I'm Emma Murphy. I'm the Director of Public Relations and Digital Media for William Osler Health System. We're better known as Osler, and we will say Osler all the time. I'm excited to be here today alongside Catalina, my very amazing colleague, and who keeps me on the straight and narrow every day. Far more organized than I am because I'm a bit of a all over the place. Together, we have had years and years of healthcare communications between us. We're not going to let you know how many years, but it's quite a few. Today, we're actually really, really proud of the campaign that we're going to talk about today and kind of what brought us to that campaign, and the elements of that campaign and the logistics as well. We did respond directly to community insights. So that's something that, maybe in larger health systems or other organizations that you've done is a community pulse take. So our goal today is that you'll find some kind of value in what we're saying, or you'll be inspired. You'll think maybe something that you're doing already is validated as well, that you're doing a good job and you're actually meeting people where they are in their space. Okay. So what we're going to speak about today is our community insights and actually the strategy around that. So we do a community survey, and we do that every year annually. So it talks about how OSLR performs in that community study and how those insights actually shape our communication strategy. So our key focus for the PR team, and our greater communications team is really to get some of those early successes and to see that we've actually moved the needle on certain things. So why tell stories? Well, we've known for years. I'm originally from Ireland, really good storytellers, especially with drinks. But a strong story can really, really grab people and pull them in. And I think our campaign really, really tells that in a very short time space as well. So I'm just going to give you a bit of kind of the context of our organization. So Osler serves a region of about 1.3 million people. We're one of the fastest growing, most culturally diverse areas of Ontario. Our catchment area is very wide. I'm not going to go into it all. You can read it. And we really have a community that's aging very, very quickly. And we're facing some of the most complex health conditions, and which that just creates for all of us in healthcare. We know that that creates a very unique set of challenges for healthcare workers and for the communities. So our population growth it's nearly triple the provincial average, which is a lot. It's expected the number of residents will increase by 44% by 2041. So 2041 seemed a long time away, but now it doesn't seem that long. There is huge diversity, as I said before, in our communities. There's a high proportion of visible minorities, lots and lots of new Canadians. English is not their first language. Many of our high density neighborhoods are home to multi-generational homes. And So all that to say, it's a very wide audience to connect with. So to set the stage for our discussion, we're going to just dive into the background of our community study. So we do employ an independent reputational scoring system, and that's how we gauge how we're perceived in our community. So it's really like going out to your family and saying, what do you think about me, when they actually, tell you the truth. So it's anonymous, and we ask a lot of questions. It allows our team to really craft those targeted, impactful campaigns that hopefully resonate with our audiences as well. So by strategically focusing on that, like that reputation building, we're trying to increase public trust. So we all know in healthcare that things can go wrong very quickly, and when they go wrong, what can you do? Firstly, you can apologize, but secondly, you are relying on that built up trust and that reputation that you have built for many years, many months before. So we regularly conduct these reputation studies. The ones that we're going to look at today the findings are from 2023 and 2024. And this was the catalyst for the campaign that we are going to show you. So conducting a community study, why would we do that? So it enables us to stay connected with our community. It'll give us the pulse, it'll give us the local sentiments. Sometimes it gives you needs for programming for specialized areas. It also builds trust by asking people simple questions and asking them for their anonymous feedback. It demonstrates that we're actively interested in listening to them and really fostering that confidence in the healthcare system. So the study offers clear direction on priority areas for improvement and growth. So we will get tips on, like what program areas to expand, or, where parking is an issue. I know parking is healthcare like #1 issue. Or Tim Hortons not being there anymore. That's another one. So understanding those opportunities and challenges really gives us, the fodder that we can take and put those into our campaigns. You look at a campaign and you think, well, like, and so what? Like, why would they do that? This is kind of our guiding star within the PR team. We do it every year, so we're able to kind of put our plans in place around the results of this community study. And why does it help? So we all know, like, everyone wants to work somewhere that they're proud of. So it's a strong reputation enhances that employee retention as well. Organizations with a positive image are, people are going to want to work there. Whoops, sorry. So it also fosters those strategic partnerships as well. So it, with government, with partners in the community, and then enhances, as I said before, that crisis recovery as well. You're better equipped to rebound from the not so good things that can sometimes happen. And we all know that crisis can happen. So the community study involves this reputation tracker. So this slide is just one of obviously many, many slides that we could put you through, but I won't do that to you. And it's consistent year over year. It shows a benchmark. So it's an Ontario benchmark for reputation of organizations. So in 2023, our benchmark score was 42. So the average benchmark is around 46. So we were slightly below, which tells us that we're, not doing a wonderful job of being perceived in the community. And that could be based on many, many things. The results are based on several questions that the independent third-party vendor has asked respondents. So when we delved into the factors, so there were a couple of like really big reasons why people had a good or a not so good opinion of our organization. And we all think wait times. That's kind of the thing that comes to mind. But it was funny when we looked at the results, we realized it actually wasn't wait times, it wasn't parking, it wasn't Tim Hortons, it was personal experience. So, and it wasn't just, I have to experience this myself. It was personal experiences of those, loved ones that are going to the hospital, personal experience, going on the website and trying to find something. The experiences start at all different stages. So the Osler community serves values. Obviously, we look at quality of care, we look at wait times, we look at operational efficiencies, convenient locations. Do we have the technology that we need to serve people? While the findings may not seem like all that groundbreaking, this to us really reinforced our understanding of what matters to the community. And so highlighting those matters and bringing that valuable data in allowed us to kind of hone in on what kind of a PR campaign we would run. So this led to the creation of our, I should say. So the previous experience that people had of Osler was very much based on the people that they came in contact with. So it was the physicians, it was the care team. There was nothing surprising about that, but we wanted to really up the reputation of our physicians within our community, not just on the ground, but virtually as well. So we did come up with the creation of, it was called Doctors Making a Difference, or it is called Doctors Making a Difference. And I'm going to hand over to Catalina now to give us a few more details on how that campaign played out.
Thank you so much. Thank you, Emma. So to build on Emma's comments, we zeroed in on the fact that the community actually significantly cares about what they hear about the hospital, about the doctors, about the care they receive. So we wanted to highlight that piece, and we wanted to highlight the efficiency of our people, of our location and technology. So the question was, how do we do this in the maximum, in a small period of amount of time for maximum efficiency? So that's how our Doctors Making a Difference campaign came to life. So we crafted it to enhance the perception of our Osler physicians and the exceptional quality of care that they provide. We focused on key themes such as expertise, innovation, and the importance of engaging patients and families in the care journey. So all this while ensuring that every patient is treated with dignity and respect. In addition to these primary goals, we also aimed to position Osler as a leading innovative healthcare organization. And we sought to foster greater engagement among our physician and staff, and also help our retention efforts for our physicians and recruitment. So let's explore a little bit further how we brought this vision to reality. Our Doctors Making a Difference campaign, or as we affectionately call it, DMD, was designed initially as a 6-month campaign with a multifaceted storytelling campaign. Each edition shines a spotlight on a physician who is going above and beyond to enhance our community's health. So we highlighted physicians from various programs. We started with emergency medicine, cardiovascular care, oncology, pediatrics, and the renal services and seniors care. This diverse focus not only helped us elevate the profiles of the physicians themselves, but of the programs and of the staff and teams that they work with. We also shared inspiring experiences. So each edition talked about the program and the care from the perspective of the patient. And to add credibility and authenticity to the campaign, each edition focused on 2 main foundational elements. So we had a compelling story that was from the perspective of the patient or their caregiver, but it was highlighting the great experience they've had with the physician and how they went above and beyond for them and their family. And then a second foundational element was a video that highlights the personality of the physician, how they what motivates them, how they what do they get up and come to work for every day, and so on. So it's a very heartfelt video. Each of them are. So these patient stories not only validate the exceptional quality of care, but also serve to highlight our programs, as I mentioned earlier. So we won't read any stories now. We invite you to do that at your own pace, but we will show a short video. The video was meant to have some voiceover as well from the doctor, but again, it's not a it's just having some technical issues. But we invite you to go to our website, look them up. They're amazing, they're heartfelt, and they're all done by our amazing colleague Colleen O'Toole, who's not here today, but she's here in spirit, and she's done an amazing work with all of these, and they're all great. This one's just one of our favorites, so it was hard to select one, but we invite you to watch them all. So I'm biased, of course, but they're lovely. So I mentioned that we have planned this initially as a 6-month campaign. We've now extended it because it's done well, and we're on our 8th edition. And we actually launched our latest one just a few days ago. So we're very proud of that. But as you can all appreciate as healthcare communicators, getting those patient stories and those relevant patient stories and heartfelt stories, it can be a little bit of a challenge at times. So to tackle this, we actually took a very collaborative approach, which sometimes is a little bit harder said than done, or the other way around, sorry. So we worked one-on-one with each of our physicians to be profiled. So we actively involved them in the process. We interviewed them and the patient or the family and caregiver. We took photos and pictures of them together, and we developed the materials within a few weeks for each of the edition. And yes, this included reviews and approvals. And then the initial months of the campaigns were, of course, a period of learning for our team, and they were marked by a trial and error approach. But this experience, and especially for me personally, truly highlighted the positive culture within our leadership team. And I truly understood that, in our team, we embrace learning and innovation and the trial and error, and mistakes happen, but the iterative approach is one that is most gives us most results. So I can confidently say that now we've ironed out the process with about time, but it's great to see that when we reach out to people, now they know what we're talking about and they're excited to participate in the campaign. So our the rollout for each of the edition is very comprehensive. So we targeted the channels that, again, were identified as most used through that community study. So for our primary audience, we've been using the website, our newsletters, social media channels, digital ads. We've done outreach to our local media partners and had ads within our local outlets. We have been amplifying the information for our stakeholders channels, have included the campaign in our regular advertorials that we use to keep in touch with our community, and through our telephone town halls. And of course, our staff and internal audiences are very important as well. So we used e-blasts with them, e-newsletters, posters within the hospital, and images on the digital screens. And we, of course, talked about these great additions and gave kudos to people in staff info sessions and in leadership meetings. So now on to the metrics. As I mentioned, we've completed 8 editions, but the metrics we're focusing on are for the first 6 editions. And I do want to note that the metrics are conservative because a lot of our ethnic media partners share articles on YouTube or on social media channels, and those channels are not typically monitored by the platforms that we use. So it's a bit of a gap there that we're working through, but the metrics we have today are still very much to be proud of. So we've had 14 articles for the first 6 editions. We've had over 21,000 views on our videos. We've had amazing comments on social media, and Instagram was our primary, I guess, most successful channel. I mentioned earlier that we've done digital ads on social, and those have done really well with close to 500,000 in reach and over 8,000 or close to 8,000 clicks. So with that, I will pass it over back to Emma.
Thank you. Okay, so our Doctors Making a Difference campaign was actually only in the market for a few months before the following 2024 community survey was carried out. But we actually do believe that it made a meaningful impact and it pushed the needle a little bit. So in 2023, our score was just below the Ontario benchmark. As I mentioned, it was at 42, the benchmark was 46. So by 2024, we had actually gone past that benchmark of 46, and we knew that this improvement was influenced by a slight decrease in the benchmark itself, and that was also coupled with a reduction in the percentage of negative opinions about Osler and a slight increase, yay, in the positive opinions of Osler. So we're eagerly anticipating our 2025 scores. So we typically do our community study in and around February, March time annually. So we're hoping that when we see the 2025 scores, that positive, the reputation score is going to be much larger than it was, and obviously surpassing the benchmark again. By that point, our campaign will have had 11 editions in the market. So I think we'll really see that, that pushing of the reputation scores at that point. And I think, as Catalina says, like it's getting easier and easier to get physicians to participate, to find patients, because it's just a knock-on effect of, physicians and their teams, they want to participate because they've seen, the good things and the comments that are coming. So we all recognize, obviously, that storytelling is such a powerful tool in the business that we're in. For Osler, it has definitely been instrumental in shifting the reputation in a positive direction. And for us, anyway, we know in our team that's no mean feat. So to conclude, we'd like to leave you just with a quote that really resonates with Catalina and I in our daily work. There are two ways to share knowledge. You can push information out, or you can pull them in with a story. So I think this campaign really speaks to pulling people into that story. And I'm sorry you didn't get to actually experience the video, but please go on our website or visit our social channels, and you can, really experience what those videos and the emotions that they bring out in people. So thank you. I don't know if we're happy to answer any questions, logistics, or anything from anyone.
Sorry, I got one up here. Just one moment.
Thanks, that was great. Are you comfortable sharing what vendor you use to carry out the community study?
Yeah, we use a company called Ledger.
Okay. Yeah, thank you.
And we can connect offline if you want more information about that.
Yeah, that'd be great.
Yeah.
Thank you.
Thanks. Oh, yeah, right back here.
Yeah, that was fantastic. I just wanted to let you know that Audrey and I supported Brendan Carr when he was the CEO of Island Health. So please say hi from his friends in British Columbia. In BC, there are 14,000 doctors, there are 45,000 nurses, and there are 45,000 healthcare aides. Did you get any pushback about focusing on doctors? And is 2.0 going to have other kinds of health workers?
That's actually a great question. We know that doctors are very well regarded within the community and respected. So we started with them, but we definitely have our plans to expand the campaign to other healthcare providers. We'll obviously have to adjust the name, but it was not an easy process at the beginning. So it took a lot of great minds that came together to kind of nominate who we should highlight at first. And then with that, as the process went on, we learned to do it a little bit smoother. So I think we're at a good pace now, but yes, for sure, we're looking to expand.
And there was an online question along those lines. I guess it was the question was, why did you start with doctors in a way? And I guess in the question it was also doctors are the hardest to engage. So what kind of response did you get from the doctors?
I think for us, so within it's a very where Osler community is based, it's a very, very culturally diverse. But when you look into a lot of the cultures, and specifically South Asian cultures, their doctors were those were the professionals that people wanted to hear from and respected. So it was an easy yet not easy place to start because we know, doctors are traditionally very, very hard to bring in. Um, I think though, as we said before, like it got easier and easier because they recognized themselves, people recognized them. There was comments coming in from the community, Dr. Mina delivered my baby and she was awesome. And so I think that, people, staff, team members, they like to see each other. And that sense of pride really, really helped with them coming forward and finding patients as well.
And I will also add that the planning for the campaign started quite a few months before the actual campaign launch. So we also looked at people within our teams who had recent achievements, like recent great innovations or a new program, or have had some great results with their program. So we try to look at, I guess, more of the low-hanging fruits at the beginning and kind of go from there.
Thank you. And we had a question here, I believe.
Thank you. I'm wondering if you could talk about the process when so I think a lot of us as creatives in the communication industry, we have great ideas in our teams, but then we have to take them to exec for approval. So if you're able to talk about what that process, as much as you're able, what that looked like for you and how you got this from conception to execution.
Yeah, I can start and then you can jump in. I think for us, we're really lucky. Our CEO is a family physician within the community. He's been in the community for 35 years, from delivering babies to now being CEO of our organization. So I think he had a very organic kind of, he was very much drawn to this, doctors making a difference and being in the community and that the impacts that had on families. Obviously, as Carly now knows, the approvals were ridiculous, and but having to vet doctors, having to go through the medical staff office, having to have all those stories, the filming, the everything else, all those pieces. Yeah, I think it's just the more you do the process, the easier it becomes. And the more the team got kind of used to, managing the process and being comfortable with it. But I think we were lucky in the fact that our CEO is a family physician. But we did have to go through all the regular approvals and, going up through the chain.
Yeah, and going back to the conversation earlier about data, we had data. Our community
Yeah.
study told us what our people are interested in, what they base their positive experiences on, and I think it was quite like fairly easy case to make from that perspective because we were able to support our recommendation.
And there was an online question on budget. Like, what kind of budget did you have, and did you spend on media, or was this mostly organic?
Part of it was organic, so we have a number of team members that are working on this campaign as part of the regular hours. But we have a writer who supports with it, and we have a photographer. Our videos, as I said, are done by our colleague in-house, but we do have that. I would just say that we probably doubled, like the value was double the spend, I would say roughly.
And question, yes.
Apologies if I missed this, but with such a diverse audience, did you run your ads in other languages that might target more people? outside of ethnic media?
That's a great question. We have not, but our website does automatically translate content as needed. So we do have other pieces of materials that we translate when we share with the community, but this one was or it has not yet been one of them.
I would say though that partway through the campaign, so about halfway through, we decided to offer the doctors that were part of that particular campaign, we would offer them to the local media for interviews. So we were like, it was a very you know, proactive decision to get doctors who, you know, represented people within the community and were able to speak the languages as well. So often our ethnic media would do interviews with them in that language. So that also helped.
Yes.
Okay, any other questions? Do we have any? So, okay. All right. Well, I guess we'll end it there and we'll break for
Thanks.
lunch.